Dozens of people in New Jersey are being told to get tested for HIV and hepatitis because their flu shot may have put them at risk. Our NBC station in Philadelphia reports a nurse used the same syringe on 67 people at a clinic in Mercer County. The needles were swapped out. New Jersey health officials say the nurse committed, quote, infection control breach. In a statement to NBC, the company that hired the nurse said, quote, Total Wellness is dedicated to ensuring all patients receive any and all screenings, care, and counseling until this matter is resolved. Joining me now, Dr. Amy Edwards, infectious disease specialist at UH Case Medical Center in Cleveland. Doctor, thank you so much for your time.
Of course.
So here the department says that there's a low risk to people. The needles were swapped out, but not the syringe. Explain to us the risk. And obviously, every person who hears this story wants to know, how do you make sure that the proper procedures are in place if you go in for any shot, a flu shot or any other?
Absolutely. So the risk is minimal, but what the risk is that even though the needles were swapped out, sometimes when you give shots, a little bit of blood can reflux up the needle and into the syringe. And so the concern is, blood from one patient, even if it was only a few drops, could have then been transmitted to another patient. Now, that risk is very minimal. It doesn't happen with every shot that blood would reflux back up into the syringe. Presumably, she would have noticed that if it had happened. But absolutely, this is a breach of protocol and should be and is, it sounds like, being taken very seriously. For you, as the average consumer, the best way to know is to ask. You have every right to ask nurses what they're doing, when they're doing it, and there's nothing wrong with asking a nurse, are you using a clean needle and a clean syringe? All right, well, one employee told a reporter that they were obviously incredible anxiety there waiting for these test results to come back. In wake of this, we'll continue to follow the story. But doctor, thank you so much for your advice and your insight into the risk factors involved in something like this, with now dozens of people waiting for these results to come back. Thank you so much.